Okay, hi, my name is Josh Stinnett. This is my assistant. His name is Justin. I am here to give a 5-minute presentation on how to receive a blood pressure with a blood pressure cuff. This is my 5-minute presentation for BA 457, Training and Management Development. So, first thing I want to talk about is how important it is to receive a good blood pressure. So everyone does this as a EMT or a paramedic, anyone in the emergency services field, as well as CNAs, anyone in a hospital setting. And essentially what we're trying to do is we're trying to see how the blood is circulating through the body. If it's happening efficiently, are we losing blood somewhere? We just need to kind of get the basics so we can figure out what's going on. This is something that in my career field, in the emergency services, I'm going to have to do on a daily basis to just about every single patient that I come across. So, now that we have that down, I'm going to talk a little bit about the equipment we're going to be using. There's two different things we're going to use. This is a stethoscope. I'm going to have this in my ears, and I'm going to be listening. Put this on the patient's skin, and I'm going to be listening for heartbeats. You'll see that here in a couple minutes. The last piece of equipment we're going to be using is the blood pressure cuff itself. Now there's 3 parts to it. There's the first part, which is here, and that actually fills with air. There's this part here, which is the gauge. That is where we're going to get our readings from. You will see that here soon. And then there's this pump. Now the pump has a valve on it. If you spin it all the way right and I pump it, it will allow air to come into here. If I spin it left, it will allow air to come out. You'll see how all this applies in a minute. Now there's this line here and it says artery. That is the artery index. I am trying to align that with his brachial artery when I apply it to his arm. The last thing we need to note on this is to decide if it's the right size. There's a little sizing index. As you can see, there's a relatively large range here that it'll fit. And all I'm saying is there's this white line here. When I wrap that around the patient's arm, is it going to fit within this area? And I've pre-measured it, and it does definitely fit his arm. So now I'm going to apply it. Just want to apply it around the arm. Kind of have them in a relaxed position. Once again, I want that artery on the inside where the brachial artery is. So it's just on the inside of the arm. I'm going to try and get it snug. I don't want it super tight, but I also don't want it loose to where it's flopping all around. So tighten that up a little bit. Now that I have it, okay, go ahead and lay your arm out flat. Okay, just kind of keep relaxed. Okay, now I'm going to run you through it and then I'm actually going to do it. But what I'm going to do, spin this all the way to the right so it allows air to pump through. I'm going to pump it up till it reaches about 180 on the gauge. At that point, there will not be any heartbeat. You will not be able to hear anything through the stethoscope. I'm going to turn it to the left barely, and I'm going to let the air come slowly out. If I do it too fast, I will not be able to get a proper recording. But what I'm looking for is 2 readings. The first reading is the very first heartbeat that I hear. At that point, it'll continue to beat until a certain point where it actually stops off and there is not a heartbeat. So I need to record these 2 readings, and that actually makes up the blood pressure itself. So, pump it up, and it's going to start getting tighter around the patient's arm. All the way up to 180. Put these on, and I will place this right in front of the brachial artery so that I can hear. Now, I slowly turn it to the left. It comes down. And I can hear his heartbeat. So on his particular arm, my first number was 130 and my second number was 70. Now that is actually fairly normal. What the normal blood pressure is 120/80. So it was a little different, a little skewed. but that could be due to all various types of things. Just something else to keep in mind. Different numbers on the top and different numbers on the bottom can mean all sorts of different things, but either way, I need to keep that in mind for when I'm assessing the patient and when I'm treating them further. So thank you for taking the time to watch this. I hope you learned something, and thank you for helping me.
Yes, you're very welcome.